Hi, this is Andrew Wolf. In this video, I'm going to talk about the physiologic determinants of blood pressure. And I'm going to sort of introduce what they are, and then I'm going to talk about the laws of physics that provide us the information about what determines blood pressure. And it will give you some ideas of sort of how to loosely calculate changes in blood pressure dependent on other physiological variables. Okay, so determinants of blood pressure. The first one would be cardiac output, which is essentially blood flow. You can say however you like it. Now, cardiac output is determined by heart rate and stroke volume. Now, stroke volume is, now heart rate is sort of its own variable. It can't be broken down any further, but stroke volume can be further broken down into end diastolic volume and end systolic volume. And this is obviously going to be related to EF, ejection fraction. Now, so what determines end diastolic volume? Well, the primary determinant of end diastolic volume is venous return. And then what's the biggest determinant of ejection fraction? It's going to be force of contraction. Okay, so the variables of cardiac output include heart rate and stroke volume is determined by venous return and the force of contraction. And I'll get into exactly how they're related when I start talking about the formulas. Now, on the other side here, we have arterial resistance. Okay, now resistance, in order to understand arterial resistance, we're going to talk about Poisseuilles law. And Poisseuilles law tells us that resistance is determined by the blood viscosity. Now, blood viscosity is going to be determined by the hematocrit and concentrations of electrolytes and proteins. And hematocrit is really sort of the major variable here. And then the other determinant of arterial resistance is vessel diameter or radius. Now, radius is very interesting because when we get down to talking about the formula, the blood pressure is actually inversely related to the radius to the fourth power. So radius of all of these variables, all of these other variables have a linear relationship between blood pressure and the with blood pressure. But radius is unusual because it has a logarithmic or parabolic relationship with blood pressure. So small changes in radius can create drastic changes in blood pressure. Okay, so just keep that in mind, and I'll talk about why that is when we talk about the formulas. Okay, the first formula that I want to discuss is called Darcy's Law. Now, Darcy's Law, if you look it up in a physics article, you'll see a little equation that looks like this. Q is equal to delta P over R. Now, in the body, Q stands for flow, And in the body, flow equals cardiac output. As we were talking about, right now we're talking about systemic blood pressure. And delta P actually refers to the drop in pressure from one end of a tube to another. So that would be P1 to P2. So delta P is actually P1 minus P2. Now, in the body, P1 is going to be equal to the pressure at the start of the arterial system, and the average pressure at the start of the arterial system is the mean arterial pressure. So that is MAP, mean arterial pressure, otherwise known as MAP. And P2 is going to equal right atrial pressure, or which is essentially the same as central venous pressure. Those of us who have worked in ICUs know that we measure central venous pressure quite frequently. Now, what does central venous pressure equal? Well, in a healthy individual, it equals 0 to 2 millimeters of mercury. So for all intents and purposes, we can consider our P2 as 0. So our P1 is our MAP, which may be, 80, and our P2 is always 0. So we can rewrite this equation for our own purposes to mean cardiac output is equal to MAP, mean arterial pressure, divided by vessel resistance. So R equals resistance. Okay, now do a little bit of algebra, and we multiply both sides times R, right? And we end up with MAP, and I'm just going to flip it. So we end up with MAP equals cardiac output times resistance. Okay, so here we are. This brings us back. I'm going to slide up here. What we have here is MAP, mean arterial pressure, equals cardiac output times arterial resistance. A nice, simple, linear formula. So you see how these two work together to give us our product of mean arterial pressure. Okay, now we have another formula that determines cardiac output. We know that cardiac output, let me just use symbols. Cardiac output equals heart rate times stroke volume. And this is pretty easy to understand intuitively. If we are trying to figure out a cardiac output in mLs per minute, if we take the volume of each stroke and multiply it by the number of strokes per minute, then we will end up with our cardiac output, right? So heart rate, what determines heart rate? Well, primarily it's determined by the level of sympathetic and parasympathetic activity stimulating the SA node and affecting the pacemaker cells in the SA node, right? So that is pretty much determined by our sympathetic nervous system or autonomic nervous system. Now, stroke volume. So stroke volume is fairly simple. Stroke volume equals end diastolic volume in the ventricle minus end systolic volume. Or you could put it this way: it equals end diastolic volume, which is the ventricle at its fullest, right? It's after it's completely filled and getting ready to eject its contents, end diastolic times the ejection fraction. And these formulas essentially are saying the same thing, and I don't want to go through the algebra of demonstrating how they're related, but it's fairly simple. So, two formulas to determine stroke volume. So, how can we affect this? Well, we can increase stroke volume by increasing end diastolic volume. And how do we increase end diastolic volume? Well, we can increase end diastolic volume by increasing venous return, because that will fill the ventricle more. Okay, and one of the ways that we can do this, how do we increase venous return? Well, one of the determinants of venous return is simply blood volume. Now, end systolic volume, if we are trying to increase stroke volume, we will have to actually decrease end systolic volume, right? So we want to have less left in the ventricle after the ventricle contracts. So to decrease end systolic volume and thereby increase systolic volume, we need to increase the contractility of the ventricle. So the ventricle contracts harder. So we need something that is a positive inotrope. Now, interestingly enough, we know that ventricular filling itself, and when I talked about this in a previous video, I believe, whereas if you increase the amount of filling, you cause stretch in the myocytes, and stretching the myocytes actually increases contractility, and that's called Starling's law. So the interesting thing about this equation is when you increase end diastolic volume, because of Starling's law, you automatically decrease end systolic volume and increase stroke volume. Now, the body has other ways of doing this as well. Remember, if you stimulate the heart with the sympathetic nervous system via the beta-1 receptors through norepinephrine from the nerves or norepinephrine from the adrenal glands, you are going to have a positive inotropic effect, and that is going to decrease end systolic volume and increase stroke volume as well. Okay, so I started talking about Darcy's Law. I'll scroll back up to it because we just talked about so remember, the mean arterial pressure is equal to cardiac output times vessel resistance. And we talked about all the elements of cardiac output. Now I want to talk about a formula from Poisseuilles' law that helps us get information about how resistance relates to pressure. Okay, so we're going to talk about Poisseuilles' law. Now, Poisseuilles' law, if you look it up in a physics article, you will find a formula that looks like this. Delta P equals 8, which is just a constant, times the viscosity of the fluid times the length of the tube times the flow divided by pi times radius to the 4th power. Okay, so we'll talk a little bit about that. Delta P here is again the same as delta P that I talked about in Darcy's formula, where we have a tube and pressure, and it's the change in pressure from one end of the tube to another, because we know that pressure changes from one end of the tube to the other. But remember, we're talking about one big tube that starts at the aortic valve and goes to the right atrium. So we have mean arterial pressure minus central venous pressure, which is essentially 0. So delta P is equivalent to MAP, mean arterial pressure. This symbol here stands for viscosity. The L stands for the length of the tube, and since we don't change the length of the tube, it really doesn't change in our body, so it's essentially a constant for us. And F equals flow, and then again R is the radius of the vessel. And this is a variable because the body can cause vasodilation and vasoconstriction. Alright, so what I want to do here is make this into a more useful formula. Now, if you do a little fancy algebra and combine Poisseuilles law with Darcy's law, then you end up with a formula for resistance, because here we started our conversation talking about the resistance part of of Darcy's law. So we need an equation for resistance here. So if you combine the two equations together, and again I'm not going to do the algebra here, you can trust me on this, resistance equals 8 times viscosity times the length divided by pi times the radius to the 4th power. So the variables that can be changed in the body are the viscosity and the radius. Now, so the resistance is directly related to and linearly related to the viscosity of the blood. So if viscosity increases, resistance increases. And it's a linear relationship. So what can increase viscosity? Well, number 1 is hematocrit, concentration of red blood cells. Number 2 is increased protein. And we see some diseases that can change protein. If you have hypoalbuminemia, your blood is going to have decreased viscosity. If you have some diseases, so some diseases can cause increased proteins. For instance, if you have multiple myeloma, this is a malignancy of plasma cells, and it can cause increased levels of immunoglobulins like immunoglobulin A and immunoglobulin M, and this can cause what's called a hyperviscosity syndrome. And then there's another disease that I'm aware of that's called Waldenstrom macroglobulinemia, which causes a similar increased concentration of immunoglobulins, which causes this hyperviscosity syndrome. And again, this is just because there's way too many proteins in the blood. And you can also do it by increasing the osmolarity of the blood. And how could you do that? Well, one possible cause would be increased glucose or electrolyte imbalances. And usually before this causes significant problems from hyperviscosity, it's going to cause other more life-threatening problems first. If you've increased electrolytes up to the point where you've increased significantly increased viscosity of the blood, you have more problems to contend with. Okay, so that's viscosity, and then I want to talk about radius. Now, radius is really important to understand because resistance is inversely correlated with radius to the 4th power. So that means if you decrease radius, then you are going to increase to the fourth power. So there's a parabolic relationship here. So very small changes in radius will make very large changes in resistance. So just to give you an example here, if you had a radius of 2, so we've got a radius of 2 and we decrease it to a radius of 1. So we've decreased it by a factor of 2. Okay, so if we're going to decrease it by a factor of 2, we are actually going to increase the resistance by 2 to the fourth power. Okay, and 2 to the fourth power is equal to 16. So we are actually going to increase our original resistance by 16 times. Okay, so obviously that's going to have a very significant effect on blood pressure, as in fact it will potentially increase blood pressure. If all of the factors are equal, it will increase blood pressure by 16 times, because remember, blood pressure has a very simple linear relationship. So if we go back to the original formula here, if we increase resistance by 16 times and cardiac output remains equal, then we are going to increase mean arterial pressure by 16 times as well. Okay, now that gives you an example of, usually the body does not decrease the radius by half in the entire arterial vasculature at once. But you can see what would happen if it did. So actually very small changes, if you took a radius of 2 and decreased it by 10%, you decreased it by down to 1.8. Even this small change, if you made the calculation, and I'm not going to do it right now, but even this small change would have a significant effect on resistance and an equal effect on blood pressure. Okay, so let me just review what we talked about. So determinants of blood pressure. So let's talk about what things can increase and what things can decrease blood pressure. All right, so to increase blood pressure, one of the things that we can do is we can increase cardiac output, and we can do that by increasing heart rate or increasing venous return or decreasing end systolic volume by increasing the force of contraction. All right, so under cardiac output, we can increase heart rate, we can increase venous return, or we can increase contractility, or in other words, decrease the ejection fraction, or increase the ejection fraction. Okay, so and then this would be exactly the opposite: decrease cardiac output, decrease heart rate, decrease venous return, decrease contractility. Okay, so then on the resistance side of Darcy's equation, Here, let's make that green. We can increase resistance and how do we increase resistance? Well, we could change viscosity, but viscosity is really not going to change from moment to moment. So we're talking here about, I want to focus here about sort of things that change from moment to moment. We're not going to change the length of the blood vessel, but what can change is radius. So increased resistance occurs with decreased radius. And remember, this is not a linear relationship. I'm going to put 4 stars here because small changes in radius can create huge increases in blood pressure, right? Or you can decrease resistance by vasodilation, right? Increase radius. And again, lots of stars here because this is small changes can make huge effects. So this is vasoconstriction. Okay, so that's sort of a few different ways to understand the determinants of blood pressure. I know this is, because of the formulas, is relatively complicated, and the concept that I really want you to understand is that these parts are linear and the radius is a inverse parabolic relationship that has dramatic effects in blood pressure from small changes. Okay, so again, please let me know if you have any questions, and please feel free to leave me some feedback. And click here on this link if you want quick and easy access to my hematologic physiology channel. And I'll see you in other videos. Thank you.